My name is Nurul Anis binti Ibrahim and I will start with the introduction. The first article by CMA 2022 explores the link between employee mental health and workplace productivity, emphasizing the importance of understanding and addressing mental health in the workplace for both individual well-being and organizational performance in a fast-paced business environment. The second article by Wu et al. 2021 highlights the increasing mental health issues among employees, particularly depression and anxiety, and the economic and productivity costs associated with these issues. It suggests various organizational practices and interventions to support mental health. The third article by Azmi et al. 2022. The article compares Malaysia and the UK's workplace mental health legal system, highlighting the need for strong laws and policies, and suggesting Malaysia could benefit from UK-style initiative. The fourth article by Fortunisa and Darmawan 2022. The article highlights the negative effects of work pressure, long hours, and gratitude on employee mental health, emphasizing the need for effective human resource management techniques. The fifth article by Azmi et al. 2022 compared the implementation of employee assistance programs (EAPS) in Malaysia, the UK, and Australia to improve workers' mental health in the workplace. The sixth article by Montero and Joseph 2023 emphasized the importance of workplace culture in promoting employees' mental health and well-being, emphasizing the need for understanding supportive elements. The seventh article by Burrows et al. 2023 highlights the mental health impacts of COVID-19 on Massachusetts healthcare workers, emphasizing the need for effective strategies to reduce attrition and improve mental health support. The eighth article by Ghazali et al. 2023 explores the impact of the pandemic on Malaysian fast food workers, highlighting heavy workload as a significant factor and suggesting further research. The ninth article by De Oliveira et al. 2022 highlight the significant impact of mental disorders on work productivity, urging for more research to inform policy recommendations and investigate rarer disorder and gender differences. The last article by Idris et al. 2023 emphasized the importance of mental health in the workplace, recommending strict rules and safe rules to prevent exploitation and promote mental health awareness among employees. The research emphasized the importance of focusing on employee mental health to boost workplace productivity and overall success. It highlights the need for comprehensive strategies that integrate legal, organizational, and cultural dimensions to create healthier work environments. Next objective. The first objective is to summarize and synthesize recent literature on workplace culture and how it impacts the mental health and well-being of employees, providing an overview of recent research findings and theories. Second, to ascertain differences in the type of workplace cultures experienced by employees, such as positive, toxic, and innovative cultures, which in the range of various mental health outcomes, such as depression, anxiety, and burnout. Third, to emphasize the place of priority for employees' well-being and mental health in organizational strategies, especially in the post-pandemic workplace environment with new challenges. Lastly, to identify gaps in the existing literature to pinpoint areas where work is required and thereby where future studies should build their work on a solid base and take out unresolved questions. Let's move on to identification of issues. First, CMA 2022. The issue identified by the author is the impact of mental health issue on workplace productivity, including job stress, depressive disorder, anxiety disorder, and post-traumatic stress disorder, PTSD. Second, Wu et al. 2021. The issue identifies the reasons employers are becoming more concerned about their workers' mental health and well-being, including prevalence and impact, workplace stress and stigma, and underutilization of services. Third, Azmi et al. 2020. The issues identified are related to mental health in the workplace, specifically when comparing Malaysia and UK frameworks. It highlights challenges like lack of specific provisions, limited legal frameworks, and employer responsibilities.
Next article written by Fortunisa and Darmawan 2022 highlighted critical workplace mental health issue. They noted the high prevalence of several mental disorders among employees. Additionally, they identified a lack of understanding of mental health implications. During the COVID-19 pandemic, personalized intervention were crucial for maintaining employee well-being and productivity. The next article written by Azmi ETAL 2022 identified key issues hindering the effectiveness of Employee Assistance Program EAPS in addressing employees' mental health challenges. Firstly, they noted that workers are struggling with increasing workloads. Secondly, they pointed out that Malaysia law specifically Section 52 of the OSHA 1994 only implicitly support EAPS. Lastly, concerns about the competency of EAP counsellor were highlighted as doubt about the ability to compromise the program overall effectiveness. Next, Montero and Joseph 2023 identified critical factors in workplace culture that significantly impact employee mental health. They highlighted the detrimental effects of inadequate social support, which contributes to burnout, absenteeism, and high turnover rates among employees. Additionally, they pointed out that low levels of autonomy at work increase stress and diminish job satisfaction. Moreover, poor leadership characterized by autocratic and hierarchical management style. Next, Borawers et al. 2023 highlighted the profound mental health impacts of the COVID-19 pandemic on healthcare workers. They emphasized the challenges of overwork leading to physical and mental fatigue. Additionally, the psychological toll of frequent exposure to COVID-19 related death was noted, contributing significantly to the stress and emotional strain experienced by healthcare workers. Moreover, social isolation during the pandemic exacerbated this issue. Next, Ghazali et al. 2023 highlighted the severe impact of workload on the mental health of Malaysian fast food workers during the COVID-19 pandemic. They pointed out that job dissatisfaction is exacerbated by wage reduction. Additionally, fear of the pandemic intensified due to frequent interaction with numerous people. Moreover, financial difficulties resulting from the economic crisis for many workers to contemplate leaving the job, particularly those facing pay cuts. Next, De Oliveira et al. 2022 highlighted issues impacting workplace performance, including methodological limitations and inadequate focus on diverse mental health impacts beyond common disorders like depression and anxiety. They also noted language bias due to reliance on English language studies, limiting insights from non-English literature and cultural context. Lastly, Idris et al. 2023 highlighted the absence of specific legislation addressing workplace mental health in Malaysia and Indonesia. This underscores the importance of self-regulation by employers in promoting mental well-being among employees. The study emphasized the need to proactive and preventative support programs within companies to address behavioral and psychological issues effectively. CNW 2022 conducted a quantitative study using structured questionnaire from 161 respondents in Klang Valley, Malaysia. Their findings indicated that depressive and anxiety disorders significantly reduce workplace productivity with a p-value of 0.007. In contrast, job stress and PTSD were found to have no significant effect on productivity, p-value 0.326 and 0.393. They recommend that managers introduce flexible work schedules and establish mental health resources to address the impacts of depression and anxiety effectively. Wu et al. 2021 used surveys and economic analysis supported by qualitative workplace assessment to explore the prevalence and impact of depression and anxiety among workers. They found that these conditions are prevalent and costly, with factors like overwork, and lack of social support exacerbating poor mental health. The study suggests implementing comprehensive mental health problem, including inflexible work hour and clear job roles and conducting anti-stigma training. Hazmi et al. 2020 employed qualitative and comparative methods to analyze the legal framework for workplace mental health in Malaysia and the UK. Their research highlighted significant gaps in this framework, revealing the inadequacy in supportive mental health and work. They recommend amending Malaysia Occupational Safety and Health Act (OSHA) 1994 to include mental health provision and fostering supportive environments within workplace. For Tunisia and Damawan 2022, India Mixed Method Study, they combine qualitative and quantitative data analysis utilizing SPSS to explore the impact of workplace factors on employee mental health. They found that high work pressure and ineffective leadership practices lead to increased stress and reduced creativity among employees. The study underscores the necessity for organizations to provide robust mental health support and implement evidence-based stress management interventions. Azman et al. 2022 focus on evaluating Employee Assistance Program EAPS in Malaysia, the UK and Australia through qualitative legal research. They identified several challenges in EAP implementation, including limited session availability, high cost and the stigma associated with seeking help. Despite the availability of this service, the effectiveness is compromised by these factors. The study recommends improving the management of EAPS and reducing stigma to enhance their utilization and effectiveness. Montero and Joseph 2023 conducted a systematic review of existing literature synthesizing findings from studies that examine the relationship between workplace culture and mental health outcomes. Their analysis revealed that toxic work environments significantly contribute to stress, anxiety and burnout. Conversely, supportive workplace that promote social support, effective leadership and work-life balance are linked to better mental health and job satisfaction. They also recommend that organizations should develop positive cultural characteristics.
Okay, so the next article is from Rowers 2023. From this article, COVID-19 caused unprecedented stress, anxiety among healthcare workers in Massachusetts. And 40% of healthcare workers' mental health greatly reduced with high attrition rates, especially among younger workers and mental health professionals. So this article suggests that systematic changes like fair compensation, flexible schedules, and mental health support are essential to retain professionals and reduce workforce attrition. Okay, so next article is from Ghazali et al. 2023. This article is about the examination of mental health among fast food workers in Malaysia during COVID-19. From this article, mental health is influenced by work pressure, organizational commitment, physical climate, and pay. So, reducing workload can help alleviate mental health problems and lower attrition rates. Next article is written by D. Oliveira et al. 2022. This article study the impact of mental health disorder, specifically depression and anxiety. The author found that emphasized the need for targeted intervention and supportive workplace policies. This article highlights methodological limitations in existing research and calls for improved inclusive methodologies. So from the article, we must stress the economic and policy implications of workplace mental health support, paving the way for future and research and initiative. Next article from Idris et al. 2023. This article studied the importance of mental health loss for employees, especially during the COVID-19 pandemic. The author found that current legislation is insufficient, emphasized the need for better policies and training managers in workplace kindness, and the author recommend to promote interventions and collaborative efforts to foster healthy mental working environments. It highlights the crucial role of legal and organizational measures in ensuring employee mental health well-being. Next, I will present the conclusion that we can conclude from this article review. From the first article, we can conclude that mental health significantly affects the employee productivity and well-being. When employees are mentally healthy, they are more productive and engaged in their work. Secondly, depression, anxiety, and workplace stress critically impact the productivity. These mental health issues can lead to decreased efficiency, higher absenteeism, and lower job satisfaction. Okay, next, improving mental health is essential for a supportive workplace environment. A focus on mental health creates a positive work culture and promotes overall employee well-being. Collaborative efforts among leadership levels are needed to enhance mental health. Leaders at all levels must work together to implement mental health initiatives and foster a supportive environment. Number 5 is employee assistance programs are vital for organizational support. EAPs provide the counseling service that can help employees manage their mental health effectively. Okay, next, further research is required to improve workplace mental health strategies. Ongoing research will help identify effective strategies and interventions to support employee mental health. And lastly, comprehensive mental health strategies are crucial for employee well-being and organizational success. Implementing thorough mental health policies and support system is essential for maintaining a healthy and productive workforce.
Now, I'm going to explain about recommendations from the articles. From the first article, it recommends that the managers should consider ways in responding to mental health issues, such as creating a favorable atmosphere for the employees and offering the company's counseling sessions. From the second article, it proposes many ideas to strengthen mental health in the workplace, such as developing a scorecard, nurturing a culture of support, and building information guides. From the third article, it indicated ways in enhancing mental health support in the workplace, such as the employers should implement mental health core standards in the workplace. Then, also, Malaysia should amend the existing OSHA 1994 to actively promote mental well-being. From the fourth article, it suggests ways to improve employee mental health in the workplace, such as setting up stress management programs like counseling and mindfulness training. Then, they also encourage a healthy work-life balance, like offering flexible working hours. From the fifth article, it suggests that employers support EAPs to get people to use them without fear of discrimination. It also states that any evaluation methods should demonstrate cost effectiveness, but this should be looking at mental health well-being more than just cost. From the sixth article, it suggested organizational strategies to improve workplace culture, such as promoting work-life balance through flexible working hours and increasing social support through team building. From the seventh article, the study recommends increasing compensation so that health professionals can have a financially sustainable career. Then, increasing workplace support to reduce stress and create satisfaction at the workplace. From the 8th article, it suggests that the future researchers utilize significantly larger and more representative samples, including factors beyond just the job related. Then, utilizing a mixed method approach like researching other factors associated with mental health for more valid study results. From the 9th article, it suggests to perform high-quality longitudinal studies to learn more about the influence of mental health disorders on workplace productivity. Then, also focus on the impact of working conditions and workplace policies to derive specific interventions and policies. From the last article, it suggested organizations should strengthen their employee assistance program to proactively support employee mental health and address behavioral issues. These programs should be modified according to the needs of the organization. To summarize, all the articles provide a variety of strategies to support employee well-being. Collectively, all these recommendations not only improve employee mental health, but also to improve the organization performance.